Thank you, Susan. I love to do these educational webbies because there's so much information to be shared, and I will look forward to any questions at the end of this because swapping ideas sometimes brings us all forward. I want to just preface this with sort of my experience with Christmas. I have two children. They're in their late 20s now, doing very well. When they were young, I used to read to them I read to them every night until they were 14. They said, "Dad, we've had enough." I didn't want to stop, of course. But around Christmas time, one of their favorite stories was Corduroy's Christmas. Now, Corduroy was a little teddy bear, and the book starts out with Corduroy just loves Christmas. There are so many things to do. And of course, it then goes into Corduroy picking out his Christmas tree and decorating it and making Christmas cookies and wrapping presents. And, it's a great children's story. And a lot of us adults are still real happy with Christmas, but not all of us. And our dogs aren't either, because change is disruptive. And there are so many dogs who struggle with a low-level smoldering anxiety that you don't notice it until some kind of change occurs. And they are very adept at watching and picking up little body language signals from their people. And in fact, you folks with the most essential work that you do in shelters, you are getting to know some of these pets, and they are watching you for leadership signals, opportunities to earn resources. So they don't sense our emotions. They watch us like a hawk, and they take their cues from their leader. And a normal dog is deferential to all humans, even those they just met. So when we deal with pet parents and some of their challenges with all this, they need to understand that if they're having a really bad time, their pet can be a real source of solace and security. But if the pet starts getting wiggy, sometimes it's better for the pet to be in a different room. And you have to determine that as we go. Excuse me, as we go. And as much as people can learn about the emotional state of their pet in different situations, the better they're going to be at handling it. And nowadays, pretty much everybody has a video camera in their pocket, and they can prop it up against a couple of books or purchase a $10 or $15 desktop tripod from the internet, and they can video their dog while they're gone from home, but also they can video their dog when it's in the other room while they're at home. And we can learn a lot more about some of the anxieties that these pets are struggling with, and we can set them up for success. And we have a wonderful tool for that I'll mention at the end of this presentation that is non-drug, no sensation, entirely safe, and highly effective. So we'll get to that. So here's a dog. Her name is Ellie. And she looks like she's having a nice time, doesn't she? Setting herself up for some tummy rubs. But look closely at her eyes. Those pupils are dilated, aren't they? Well, this dog is a nervous wreck. That's what we're looking at here. But she's conflicted. This was shot by her person. And this dog came in as a behavior case, and we'll talk more about her in just a minute. But she was very happy with her people, but then she could get triggered. This is the kind of dog that can be a problem when folks have guests, which I know people are not supposed to do during the epidemic, but this kind of thing does happen, doesn't it? And the advice that you can give people can have everything to do with them understanding what's going on with their dog and doing the right thing, making good choices. So this dog has got conflicting emotional states. It's nervous, those eyes are dilated, but she's rolling over on her back like she wants interaction. Okay, so let's just look at every aspect of body signaling. We'll talk more about that in just a minute. Okay, but change in the home, it's not fun for everybody. Again, especially if a dog is struggling with a low level of anxiety, and then it rises to the surface when there are changes. Okay, and they can freak out and bite when they feel frightened. They can feel trapped. Even when one of us would say, well, there's no legitimate reason for this dog to feel trapped, we need to look at things through the other creature's eyes. We need to walk a mile in their moccasins. That, of course, is empathy, and we can accomplish that with pets, even though they're members of a different species. And when you present that to pet parents, they can say, I think I can do that. and you can set them up for success as well. So yeah, sensory overload, the kind of stuff like all the noise and the people and the smell of food, opportunities to counter surf, being reprimanded, all of that stuff can ratchet up the tension for these dogs, and unintentionally, of course, setting them up for failure. Okay. So yeah, difficulty adjusting. And of course, what we gently call dietary indiscretion, like raiding the trash and eating a turkey rack and swallowing splinters of bones. I've dealt with that in general medicine. I can promise you that. And of course, chocolate, people need to be warned every year that if the pet even gets a bite of it, it needs to go directly to the emergency clinic, not have people be vigilant and watch and wait to see if the dog starts twitching or even seizuring, because by that time we've wasted a lot of time and we have a hard time turning those around. So here's a dog in the exam room, but it was just a great example of a dog who's just nervous in a particular context. Look at the way she sticks to her person like glue. She often goes under a chair, but then if her person takes a half step away, she's standing up against her. She's trying to you know look for security anywhere she can. People sometimes just think the pet wants attention. Well, yeah, maybe, but their pet may be more nervous in certain situations than others, and they need to start parsing apart the differences, and you can help them do that. Just point this kind of stuff up. Again, another dog in the exam room, and this one, dogs are denning creatures. We all realize that. And so in a situation like this, her person is doing the right thing by squatting down. Notice that this lady has got her side turned to her own dog. And when dogs interact with each other in a free living situation where they don't have the constraints of rooms and fences, they signal each other in very canine specific ways. And one of the ways that one dog will indicate to another that I'm not a threat is they turn their side. And for a person, of course, we stand much taller than dogs, and that can trigger their fear. So squat down, make your appearance smaller, and then turn your side, and it can be disarming. But even still, this dog wants to come out and interact with this lady, but notice the way she is scanning and looking back and forth. This is a nervous little dog, but she wants to be near her person. She moves to the other chair just because she's closer, but she's under a den-like location, which again, this dog, I suspect that if anybody made the mistake of reaching under the chair to try to pull her out to handle her, maybe wouldn't bite, but maybe she would. I was 4 years old when I got my first bite. I was visiting my friends of the family. My folks and my older sister were there at their house. They had a son about the age of my sister and myself. And the adults were at a card table playing cards, having iced tea. And they had this wonderful little Boston Terrier, and I didn't have a dog. And I love pets. So there it was under the card table, a lot like this red heeler. And I was going to go and hug that dog because I just wanted to pet it and touch it and be affectionate. And so I crawled under the table, little 4-year-old boy, and I didn't know any better. I had no idea what this dog was signaling, but when I reached to hold that dog, it bit me in the face. Dog was trapped, had nowhere else to go, and it was under there because it was scared. And none of those adults had any idea. And despite how many years ago that was, people still don't have any idea. So it's our job to educate people, okay? So this is a research study done by Dr. Ilana Reisner. Dr. Reisner is a member of the Veterinary Behavior College, and in fact, she was one of the founding members of it, has done a great deal of really essential research, and a big area where she has focused is on dog bites to children. And this is a study that she published, and I'll give you the takeaway first. The takeaway is don't gamble. If a dog is showing any signs of nervousness, especially if you're having a holiday situation where there are other people together, and you again counsel people that they've got a dog who has shown signs of anxiety, I wouldn't gamble at all. Simply don't let the dog be near the children, period. Don't say, oh, he looks all right, I'll supervise. Their reaction time is far quicker than any human. And if they decide they're going to bite, nobody can get in the way of that. Okay, so this study was done at the Children's Hospital of Philadelphia. You can see it was a pretty generous number of kids. Every single one of these, by the way, had visited the emergency department with a bite injury from a dog. These weren't minor things where there was just a little scuff on the skin. These kids had real injuries. They needed real medical attention. So these are severe bites, okay? And look at how many of them were little tiny kids. And the problem, one of the other, and this is not mentioned in my bullet points, but one of the other things Dr. Reisner came to learn was that it was about 55% of the kids in this study, there was an adult present. We say, well, they should not be with children without supervision. That's absolutely true. But more than half of them were supervised, but the adults didn't know what to look for. So we don't assume, do we? Okay, look at this. The great majority of them actually knew the biting dog. It wasn't some stray dog. It didn't happen out on the street. It was sort of what happened to me with that Boston Terrier when I was a little 4-year-old kid, little pet lover that I was. Okay, what did I know? Okay, during positive interactions initiated by the child. Sounds like me, right? Well, there's some real takeaways here. And what we really need to impress on pet parents is the essential nature of them understanding what they're dealing with, okay? So video monitoring, this was done, and you'll hear the client's voice. She was actually standing there getting this video, but you notice her dog is just ears back, nervous panting, tail down, not moving around, not sniffing and relaxing. This isn't normal behavior. Here's the other video, same dog, obviously, same room, different day. And, you know, I mean, look at him. He's doing stuff that doesn't even make sense. This dog's a nervous wreck. Just that posture, not moving. Scanning, head moving back and forth. You know, people, you would think, well, who would not recognize those as indicators of anxiety? Most people don't. Now, this is one taken when these folks were away from home. This dog had a problem with, well, I'll show you what his problem is. And by the way, you can see this little rascal here, a little Bichon Frise cross. And over here, you might not even notice, because he's not moving, is this big old Great Dane. All right, this guy's relaxed and behaving pretty normally. All right, so these folks just set up, you can tell this is a surveillance camera. It's up in the corner of the, whoops, let me back up here. There we go. And we'll show what this little rascal's doing. His name is Leaf. Here he comes. People are gone. Why is he walking around when there's nobody there? Well, we've got a little thing we have to do just because we're nervous. They came to recognize that the dog's house soiling problems, which is the big reason they came to me with him, only occurred in their absence. They didn't realize that until I asked them. And now he goes out the dog door to the back door. And if you look at the entire video of when they were gone, you find that that little guy's in motion most of the time. He's not resting and just hanging out like the Great Dane, who is pretty behaviorally well adjusted. And I'm showing you these things because this is a separation anxiety problem you just saw, but you see other indicators of anxiety, and often there's an overlap. These are not discrete diagnoses like a dog with separation anxiety, and that may be his only behavior disorder. But if you really talk to people in depth and ask the right questions, you'll find that anxieties are often what we call comorbid. In other words, different problems occurring at the same time. Okay, now here's a guy who is really distressing, and they found out their dog had a problem because their neighbors were complaining. Now that's Mookie, and Mookie has a bad day every day, or he did have, and we did get this thing improved significantly. And you think, well, that's separation anxiety, the people are gone. What does that have to do with nervous pets at Christmas time? But here's the connection, is that we find that many of these pets are nervous when they're away from their person, whether the person is in the house in a different room or whether the person is gone altogether. So back to that video surveillance business, you want to do it when the people are gone, but you also want to encourage them to do it when the pet's in the other room. And when we finally get out of this epidemic and people can start having guests, this kind of thing is going to become more noticeable. And we need to gather information on these pets, whether we're with them or not. People, I watch my dog, he looks all right. Yeah, let's find out what she's doing when we're not with them, because that really changes the dynamic. And this little guy illustrates what happens when a dog is scared. And you can look at him right here. Look at the way he's not got his head turned up completely toward his person. Got that crescent moon shape of the white part of the eye, what we call a whale eye. And he's a nervous wreck. And you see the mistake this person is making is standing and leaning over the dog, unlike that lady in the previous slide with the red heeler. And listen carefully and you'll hear the dog as well. She's a lip licking. Little growl there. This dog is conflicted. This dog loves this person. This dog trusts this person and wants to be with him, but is scared to death by the person who loves him because this person is standing so much taller. Now, some dogs would not respond like this. Some dogs are completely well adjusted. This little guy's a nervous wreck because this person is leaning over him. And I can assure you, if this man sat down on the floor or even lied down on the floor, the dog would be tickled. And you'll see in just a second why. But you notice right here, ears back, head not oriented completely toward the person, but his eyes are looking up at him. And he wants to be with him, but he's scared. Oh, now we're happier. Oh, nervous again. Lip licking. Oh, now we get to go and play. Now we feel better. People don't recognize this stuff, and they often repeat this kind of interaction with their dog, believing that the dog's going to become more relaxed if they keep doing it. It's like taking a child who's terrified of the water up to the top of the 10-meter diving platform at a big swimming pool and pushing them in repeatedly. This is called behavioral flooding, and it almost always goes bad. Okay. Avoidance of fear triggers. That's really one of the most important things we can teach people. Okay. So here's this little dog, Ellie. You saw her before. And yeah, children don't listen, do they? We think they should. And it's important for parents to tell kids what to do and what not to do, certainly how to behave around pets. But we should never trust them. Even Lassie, the perfect dog, should never, with a history, a stellar history with children. Some kid could do something, and some kids do mean things too, don't they? And then the kid gets bitten, and people say, "Well, the kid deserved it." Well, maybe that's the wrong message, because the dog just had another repetition of reacting and meting out that fear-driven response, and the dog actually gets faster and more prone to the behavior because it drove away the scary monster. It became a self-rewarding behavior. So let's practice avoidance. Okay. If you've got a dog who you are not 100% supervising, who shows no indicator of anxiety related, fear related behaviors, then okay. But you better watch carefully, because you're doing the dog a disservice as well as potentially putting people at risk, especially children. Okay. Assume that they're going to find a way. You tell them what to do and it's out the other ear. We know that. If you haven't raised kids, talk to anybody who has, all right? Because they can panic. They get backed into a corner like that little Boston Terrier who bit my face. So here's what goes on with Ellie when somebody's pushing the envelope with her. Well, when that person leaned toward Ellie with her closed fist, the back of her fist like that, it wasn't just the hand approaching, although that is clearly a trigger, but the leaning over. This person is standing. Yet this dog's emotional state goes back and forth several times because when the person backs away or leans away and then gives her a command, she's very well trained. She immediately took the treat, but then when the person leaned forward and moved her hand forward, and by the way, this video was shot by Ellie's very own person. And you think, really? Yeah, really? Conflicting emotional states. This dog has a real fear problem. And the tendency for so many people is to reprimand or to punish. Well, let's think about the emotional state that's driving this. And if any of us, and I think we all have, felt anxiety or trepidation in some situations, uh, honest to goodness fear, and then somebody treats us harshly, we all carry that little child in our heart. You don't treat children that way. Well, adults carry that too. And what we need to do for everybody, dogs and cats and other people of all sizes and ages, is if I can't figure out what the motivating underlying emotional state is, maybe I should just assume that maybe it's anxiety and fear and avoid the trigger. So here we've got a diagram showing some of the behaviors that, well, they can coexist. And principally, look in the lower left corner, fear of strangers and separation anxiety. Well, a third of the dogs who have separation anxiety are worried about unfamiliar people. And look at some of these other things. You can say, my goodness, that encompasses a lot of the behaviors that have caused pets to show up in the shelter in the first place. I saw a case just the other day. This pet had been to the shelter 5 times, the same shelter. The staff knew the dog by this time. That dog's problem was that it kept jumping the fence. Different behavior, although that's often seen with dogs who have separation anxiety. They don't all just wreck the house. So when we look at a behavior issue, it isn't just what is the problem. Really, the question is, what are the problems, and try to integrate them and come up with a good solution. Because as you folks know, as well as I, behavior issues are the principal reason that pets end up in shelters. And it's the principal reason that they get returned. So here's Lulu, and I'll show you this video in just a second. But this person, this was one of my cases, and I taught her person to preempt and reduce. This dog had a separation problem, by the way, which again, if you put a dog in another room because you have guests, there can be a separation problem during that event, and then a different fear-related problem when they're with the people. So these things go together often. Let's set the dog up for success. Make it comfortable. Food dispensing toys and puzzles, and there are a whole lot of them. And again, shelter staff, you folks know that very well. Most of you are probably using those to very good effect, okay? Through a dog's ear is music that's been scientifically developed to synchronize with the calming alpha waves in the brain, and it promotes more of those. You can go to that website. It's called Through a Dog's Ear. They have Through a Cat's Ear as well. Different species, different music. And by the way, very pleasant sounding music, very enjoyable. And you can download it. People can download it to their computer or order the CD and play it. It can be done while the pet's in the other room, while they're having guests at Christmas. Can also be done while they're gone from home. A noisy fan, can drown out the sound from people in the other room, for example. And if they're in a wire crate, it should be covered with a sheet or a towel, the sides, the back, and the top, so it has that den-like feel. But the door, allow the dog to have a choice so they can enter or exit, just like they would a real den if they were free living. So here's Lulu, and this particular type of food toy is just one that she pushes it around, a little bit of dry food comes out. It's doing more than keeping her occupied when she's not with her person. It's actually primal canine foraging behavior. I instructed her person to withhold food prior to her absences, so the dog was food motivated. So here's this device I mentioned earlier. It's called the Calmer Canine. It's a pulse electromagnetic field device that adjusts the neurochemistry within the functional nerve cells in the amygdala, the fear center of the brain, called the microglia. And this is for long-term management. You don't do this while the day that people come to the house. This is done for long-term issues. It does take 4 to 6 weeks to start making a difference, but coexisting anxieties, it's FDA approved for treatment of separation anxiety. We use it in a lot of other cases with equally good effect. And this is, excuse me, this is fundamentally how it's used. You can see the person with that little Lhasa Apso on the upper left corner is simply holding the device. But this Aaarrgh setter at the bottom, this is what they call the vest. It's a very comfy little fabric thing with Velcro closures that goes around the dog's neck and chest. And then you stick that little lightweight halo-shaped device, and it targets the amygdala, the fear center of the brain. And we have found these to be really helpful. And you can see that they wear it very comfortably. So these are the takeaways. This is what we want people to understand about their pets. Know what they're dealing with as best they can. And observe, what's the dog like when everything is calm and relaxed around home? Does the dog respond to sudden noises? What's it like when they're not with the pet? What's it like when the pet's in the other room? Okay. And assume that children don't know nothing, even though they think that we adults don't know nothing. They're the ones who don't know nothing. We're the ones who need to take charge and be the leaders and prevent trouble for them and for the pets. Okay. We reduce anxiety, and consider recommending the Calmer Canine. This is something that is so easy to use. This is a little dog named Sufi, and I have a little quick video just to show that she is the playful little spark of joy that anybody would love to have in their home. And here she is wearing her Calmer Canine. It's comfortable. They don't have to sit perfectly still during these twice daily 15-minute training sessions. They shouldn't romp around outside, but they can, follow you around the house, sit with their person while they're having breakfast or answering email at night.